Hello, my friends. It is Dr. Darla, and today I want to share a little bit about something that comes up in the office almost on a daily basis, and that is cortisone shots. Now, I want to preface this whole video with the fact that I do not do cortisone shots in my office, largely because the effects of the cortisone shots are very temporary. They are what we call palliative, meaning trying to get you just out of pain. And what I focus on in my office is really healing up the body and healing up the injuries in the most natural way that we can do that. And so cortisone doesn't really fit so much into the regenerative medicine space. In fact, cortisone is the opposite of regeneration. Cortisone is an very potent anti-inflammatory medication, and it oftentimes will work very well to decrease pain, but it doesn't do anything to fix the injury. And so on the regenerative side of medicine, now the whole purpose of regeneration is to actually fix the problem. Hi Randy, thanks for joining. The whole purpose of regenerative medicine is to actually fix the problem and not just cover it up or band-aid it. So with cortisone shots, some people experience some relief from them. Some people experience a lot of relief from them, and that can be a varied amount of time. Some people report a few days, some people report a few weeks, some people report a few months. And arguably my sample size is going to be biased because the people that I'm seeing, if the cortisone shot had worked for them long term, they wouldn't be in my office looking for something additional. So having said that, note that the people that I see are largely people that either had cortisone shots and they didn't really work well, or the cortisone shots are something that they chose not to do because of the health risks. One of the places that I see cortisone shots being used very, very frequently is in the cases of osteoarthritis. So osteoarthritis is a breakdown of cartilage in the joints. It can happen in any joint. It can happen in your fingers, it can happen in your elbows, your shoulders, your knees, your spine. Any joint where two bones come together, there is a cartilage covering on each side of the bone so that those bones will be slippery, slidey, glidey, and move over each other without pain. And when that cartilage begins to break down, either mostly through inflammatory processes, we get a lot of pain and sometimes swelling with that. So one of the treatments that is available in medicine is a cortisone shot, and that is to decrease the inflammation and decrease the pain. Like I said, sometimes that works for some people, at least for some period of time. When we do cortisone shots, what it does is it keeps us from being able to use any of the regenerative injection techniques until that cortisone shot effect has worn off, and there's a certain period of time for that to move out of the body. So I don't like to do any kind of regenerative treatments within 4 weeks of a cortisone shot. And I'm very upfront about that with my patients because I think it's important that you get the most benefit out of the treatments that you come to me for. I'm not interested in treating you with something that I know is going to have limited effectiveness or not a very good expected outcome just for the sake of collecting money. I've never been in business for that. I have no interest in doing business that way. So if you come to me and we talk about cortisone shots and you've had one and it's been within a certain time frame, then I'm going to suggest that we postpone any of our regenerative treatments until a later time so that you get the best result that we can possibly get for you. I do think that there are some limited cases where a cortisone shot might be beneficial. Like I said, it's very limited and it's something that I don't do in my office, but I have recommended it for a couple of patients in some very specific and very tight constraints. The things we have to remember about cortisone shots is there is actually a fair amount of risk. And when it comes to cartilage damage, which remember is one of the most common reasons why cortisone shots are used, after a certain number of cortisone shots, we know that there is actually increased cartilage damage. So we take a problem and we're trying to fix it, and the medicine can potentially make that problem worse. So We also have, for people who have blood sugar regulation issues like diabetic patients, we can see a spike in their blood sugar. So if they're not expecting that to happen, we can get some problems with either not enough insulin, or somebody could potentially take too much insulin. So you have to be careful with regulating what your insulin intake is if you're on insulin and you are a diabetic. And then, anytime that we puncture the skin, and that's with any injection, there is a risk of infection. I think that risk is probably on the lower end, but we also get some other systemic effects, adrenal gland effects, etc., that can come from cortisone shots. So it's not a treatment to take lightly. It's a very common treatment. For the most part, people don't have a great amount of adverse reactions, meaning that there's not a lot of people who are dying from that particular treatment, but we also don't get long-lasting results. So remember, if you're using that treatment, use it for what it's intended for: palliation, comfort care, decreasing that inflammation and the pain, and hopefully it will get you to a point where you're not in an extreme amount of pain. But there is a trade-off. If you're wanting a long-term solution, you may be postponed in being able to get those treatments. So I hope that is helpful in kind of understanding what cortisone shots are about, why I have chosen not to use those in my practice, and how they are detrimental to the actual regenerative medicine techniques that I use in my office for long-term healing. So it is Thursday afternoon. I hope you guys are having an amazing week, and I will talk to you again soon. Bye-bye.